Alright guys, we're going to talk a little bit about the spine and the nervous system. There's a couple reasons we take the spine particularly seriously. One, it's the structure of your body, and so any sorts of problems with the spine, any way it's compromised is going to lead to structural issues which make you prone to injury and wear and tear. But the biggest reason we take the spine seriously is because it actually functions very much like your skull. So it's different from your arms and your legs in that it surrounds and protects the nervous system. Your skull, if somebody were to hit their head really hard, our first concern would not be with the skull itself, but with the brain. We're worried about brain damage, concussion, hemorrhaging, bruising, inflammation, that sort of thing. The same goes for the spine. The spine forms a tube that surrounds and protects the rest of your central nervous system. And so whenever the spine is compromised, our first concern is with damage, stress, strain, any sort of interference with the brain's ability to communicate out to the body. Your brain's got to get messages down that spinal cord and then out the nerves to tell everything in the body what to do, to make your heart beat and your lungs breathe and your stomach digest for you. So when we look at the spine, a normal healthy spine from front to back should be nice and straight with the hips even. And then from the side, we should have three curves, one in the neck, the mid-back, and the low back. And we want the head over the shoulders over those hips. The bones in the spine are called vertebra. They form a tube where your spinal cord sits inside of there. And the little pads between the bones, those are the discs, or the rubbery pads that let you move around. Then there's little holes in the side where those nerves come out. So I'll show you here what happens. If we take, for example, this nerve right here, if these bones shift out of position, you'll see that that spine, or that nerve gets compressed. So kind of like kinking a garden hose, it clamps down on that nerve. Also, if we flip around to the other side of it, you'll see that it puts an undue stress on that disc. It starts to bulge out this other side. What that means is that, kind of like kinking a garden hose, one, there's damage in that area, which means the brain can't communicate clearly out to the body. Two, it's structurally destabilized, which makes that person very prone to injury, blowing out a disc, etc. Three, the longer it's there, the more it's going to degenerate into arthritis, degenerative disc disease, stenosis, etc. And this may, or one thing to understand, this may or may not hurt. So only 5 to 10% of the entire nervous system deals with pain. That means 90 to 95% of the time there's a problem, it doesn't hurt. If that nerve right there is crunched and it goes right out to the stomach, right, whether it hurts or not, we know that the brain can't communicate clearly, which means the stomach isn't going to be functioning like it should, which means over time it will develop sickness and disease. So again, we take the spine very seriously. One, for the structural implications. Well, I want people up and running and able to stay active their entire lives. But most importantly, we take the spine seriously because of the neurologic implications and how that affects our long-term outcomes. And when I'm addressing a patient, we're going to take all of that into consideration, because the last thing I want to do is just make someone feel better without really resolving underlying problems that could be troublesome for them down the road. So look forward to taking care of you, and that's kind of the spine and the nervous system in a nutshell.